PhilHealth Department has logged a new record high in COVID-19 cases at 22,300. PhilHealth won't be pushing through with its circular on suspending hospital claim payments. The Justice Department is set to submit its drug war findings and recommendations to President Duterte this week. The Pacquiao-led faction of the ruling PDP-Laban party has defended its move to oust the president as chairman, saying he has been overstaying in his position. And in lighter news, visual artists from Taguig paid tribute to the country's Olympic medalists in their latest mural at the tenement basketball court. Focused and fearless. Here's a roundup of stories we're watching now. I'm Sean Yao. The Philippines once again saw a record high in COVID-19 cases today at over 22,300, pushing us closer and closer to the grim 2 million mark in total infections. To share with us his insights, Professor Guido David of the Octa Research Group is now joining us over the phone. Good afternoon, Guido. Thank you so much for joining us again. First off, I wanted to get your initial reaction to the case bulletin today. You just, of course, said we might hit 20,000 at around lunchtime in the Laging Handa briefing. Was this expected?
Well, I mean, it's, I would say it's in the upper range of the estimates that we were expecting. So this is obviously not a good number. It's higher than what we, it's on the upper side of what we were expecting. The reproduction number has increased to 1.39 in the country, and we're expecting somewhere in the neighborhood of 6,000 cases today in the NCR. Once we see the breakdown, well, the only upside is that tomorrow's a Tuesday, so we're expecting a dip down to 14,000 on Tuesday.
All right, having said all of that, will you guys be doing any adjustments in your current with your current projections or perhaps your current calculations? Are you going to, or are we going to be seeing daily cases surpassing 25,000 anytime soon?
Yeah, well, definitely 25,000 is the next, you know, I would say, I wouldn't call it a milestone, but it's the next level that we are, you know, sort of looking at. So we will have to, yeah, you're correct. We'll have to make adjustments on the numbers, on the trends and the projections. Probably not this week. It's probably not going to hit 25,000 this week. But we will have to reevaluate if there's a chance that we'll hit 25,000 next week.
Right, perhaps this is not the right thing to say, but I am looking forward to your new and recalibrated calculations. Guido, you also previously said that the reproduction rate, at least in the NCR, is slowing down. However, we are still seeing record cases. Can you talk us through how this is possible, just to clear it up, the math behind it?
Well, when we look at the breakdown, what we see is that we were getting record high numbers in Cavite and Laguna last week, and also in Cagayan. So there are some areas, particularly near the NCR, which are seeing record high numbers, and the reproduction numbers very high, or even accelerating or increasing. So these are adding to the large totals that we are seeing right now in the country.
All right, I guess I'm going to have to ask you whether or not the 2-week ECQ and extended MECQ periods, if they were enough to mitigate the surge, did it work in short? Or should the government now revisit classifications and strategy?
I think the government should definitely at least you know, sit down and re-examine, you know, classification strategies and maybe think about priorities, especially now that we are hearing that, you know, healthcare systems with, you know, boycott going on and people resigning, you know, it could be on the verge of collapse. We're seeing I mean, even though the numbers are not yet record high in the NCR, we're actually already seeing record high numbers in terms of ICU occupancy and hospital bed occupancy. The ICU occupancy right now in the NCR is 200 beds higher than last April. So there are some things that that could be problematic down the road. And I would have to say it, but if the government really wants this to slow down, I mean, I think they know what they have to do. I mean, if we're just looking at the public health aspect of it.
Right. The government's also proposing, or at least some proponents in government are proposing, that we shelve wide-scale lockdowns and shift to granular lockdowns in the meantime. In the light of the numbers, do you think this is still possible or will be effective?
Well, if they're thinking about MECQ with granular lockdowns, that should be more effective. But if they're thinking of downshifting to a GCQ with granular lockdowns, it might have unintended consequences because we have, I know that we have tried granular lockdowns. We've tried a GCQ with heightened restrictions with some granular lockdowns in the past, and we saw that the numbers ballooned. So, and just to reiterate, the 2-week ECQ was actually effective. Yes, the cases did reduce, but the reproduction number decreased, and that's what we were counting on to happen. If the reproduction number is starting to increase now, that would be an indication that our current interventions are not working.
All right, it's also been several months now since we rolled out vaccines and vaccine drives. Have we actually felt the impact of vaccinations, especially under this most recent ECQ period where we really ramped up vaccination? What are your thoughts on this, or what do the numbers say?
Well, Sean, this may be hard to believe, or people may find this hard to believe, but vaccinations did actually have an impact. And the reality is the surge would be a lot worse if we did not have vaccinations. It would be a lot worse than what we had in April. I mean, even especially in the NCR, we could be seeing, record high numbers in the NCR. So we're already feeling the impact of vaccinations. But unfortunately, even those vaccinated cannot be complacent. They still have to follow health protocols. Why? Because vaccinated people can still be spreaders. And there will be some breakthrough infections, although preliminary data that we're looking at shows that breakthrough infections for vaccinated people is actually at a very acceptable level. And it shows that the vaccinations do work in preventing severe COVID. But at the same time, we're still seeing record high numbers of ICU occupancy. So it means that a lot of people are still getting infected with severe COVID. I mean, I can't say right now if it's mostly due to the unvaccinated, but we'll have to look at a bigger set of data for that.
All right. Well, with the current set of data that you do have, can you share with us perhaps other observations when it comes to trends, especially as cases of Delta are continuously rising with gene detection? Anything interesting coming out of your trends and your numbers?
Well, we know that the Delta is dominant already in the country. Latest genome sequencing shows that it's about 70%. So if we're taking 70% of 22,000, that would be somewhere around 16,000 cases today with the Delta variant. And that would be, I mean, if we think about it, that's a lot. And most of the transmissions are most likely the Delta variant, especially in the NCR. So I wouldn't be surprised if it's, much higher than 70% in the NCR. And this is hard to stop. We know that because we have seen this in other countries, in India, in Indonesia, in Thailand. So, we really have to do something about this, or else if we don't, we'll just well, the population will just, the Delta variant will just rampage through the population.
Right, and a lot of people are saying, of course, that is the nature of viruses, to ravage through the population. Any sort of estimate or guesstimate as to when this will hit critical mass?
Well, I haven't looked at that number, Sean. I'm honestly afraid to look at it because, when I see really high numbers, it gets really depressing. But maybe as you said, we'll get back with you on that one.
All right, I can't exactly say, looking forward to that, but I am interested to see what you come up with. Thank you, as usual, for your time and your insights. Professor Guido David of Octa, thank you. In other news, the probe into the government's purchase of overpriced medical supplies deepens as lawmakers try to identify the backer of a suspicious firm that bagged the contract. Marian Enriquez with the story.
Stop lying! That's will put you in contempt and lock you up in Pasay City Jail. You're insulting the Filipino people. This is the Congress and the Senate of the Republic of the Philippines.
Senator Richard Gordon was obviously enraged at former Budget Undersecretary Lloyd Lau after he tried to evade questions on the 42 billion peso fund of the Health Department transferred to the DBM. The funds were allegedly used to buy overpriced medical items, such as masks at 22 pesos apiece. Formerly Pharmaceutical Corporation, a newly incorporated company, supplied the products. It was able to bag contracts worth over 8 billion pesos, even without prior bidding records. It was also revealed that the residential addresses of its officers were bogus. Senator Franklin Drilon suspects that Pharmally is being favored by Lau.
Mayroon bang MBA itong si Undersecretary Lau? MBA, hindi po TED, hindi yan Masters in Business Administration. MBA, may backer ba ako? At bakit po ganun kalakas ang Pharmally?
But Lau said they sent letters to special envoys asking for suppliers of medical items until they were able to have a meeting with Pharmally together with the Chinese embassy. Gordon then presented a footage from a 2017 meeting of Duterte with a pharmaceutical company.
Pharmally President Wang is here. Do you know Mr. Wang? You said he just came into your door, right? In your office.
I do not know him personally, Mr. Chair.
Oh, come on.
Pharmally is owned by a certain Wang Chu-yen, whom Gordon said was present during the meeting.
Andun ang ating FDA, andun ang Assistant Secretary of Health, hindi ko alam kung iba pa, andun yung presidente nitong Pharmally, na siyang nakatanggap ng lion's share ng overpriced mga PPE na mga gamit.
The Senate will subpoena those officers involved with Pharmally in the next hearing on September 7. Meanwhile, PhilHealth has put on hold a circular suspending the payment of suspicious hospital claims. The call came from several lawmakers who said it would only lead to more hospital closures. Groups also warned that they would disengage from PhilHealth if the policy won't be withdrawn. For News 5, Marian Enriquez, we are One News.
A quick look now at today's other top stories. The Pacquiao-led faction of the ruling PDP-Laban party has defended their move to oust President Duterte as party chairman. Executive Director Ron Monsayak said that the president, along with Vice Chairman Alfonso Cusi, are already overstaying in their positions. The Pacquiao wing of the PDP-Laban party has elected Senator Coco Pimentel as new party chairman. The Justice Department has finished its review and recommendations on the 52 drug war deaths as submitted by the Philippine National Police. Justice Secretary Menardo Guevara said the report will be turned over to President Duterte this week. The PNP submitted the cases to the DOJ last June after finding administrative liability among the policemen involved. And healthcare workers from different hospitals stage a protest in observance of National Heroes Day. They are calling for the immediate release of their long overdue special risk allowances, as well as other benefits promised to them by the government. The Alliance of Health Workers has warned that more medical frontliners will hold protests on September 1 for their National Day of Action. For more updates, visit News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Masks on, wash hands, and stay safe, Philippines. I'm Sean Yao. We are One News.